Hello everybody, welcome to our October workshop video. For this workshop, Kyle and I are presenting return to play criteria and functional testing for ankle injuries. Alright, so ankle sprains are one of the most common injuries in sports. They account for 45% of all injuries and 10% of emergency room visits. Um, they've been increasing over the past 30 years, which is kind of surprising with all the new technology in shoes and braces. Um, between 19 and 72% of patients with an ankle sprain encounter another in the future, and 70% develop long-term symptoms, which can lead to chronic ankle instability. Chronic ankle instability has symptoms that include feeling of instability, weakness, pain when active, constantly spraining the ankle, and things like that. So return to play can have a big effect on this, and that's why it's so important to understand proper technique for evaluating and returning these athletes to play. So the return to play process has three main parts, the first being evaluation, the second being rehabilitation, and lastly is the return to play. First, we'll talk about the evaluation. For the evaluation of the injury, the first thing you're going to look at obviously is the extent of the injury or how severe it is, through the use of special tests and finding out which ligaments are sprained, what kind of ankle sprain you're dealing with. You need to find out if there's a history of previous ankle sprains or chronic ankle instability. Go through a physical examination and uh, assess whether or not imaging may or may not need to be done. Right, the next step to look at is rehabilitation. This needs to be tailored to each individual athlete and to each different ankle sprain. It has four steps. First is joint range of motion, strengthening, proprioception, and then activity-specific training. It's important to let the athlete know about the phases of healing and help them understand this so they don't try to rush healing and potentially set back their rehab. Also, for neuromuscular control, it's important to let the athletes know about retinaculum, ligaments, mechanoreceptors, and other things that could possibly be damaged during this injury. Um, Lastly, it's important to make sure that you restore all strength deficits. It's important to have good muscle function for proper movement patterns, which could help prevent uh, any future ankle sprains. Um, and it is very important to exercise all the muscle groups concentrically and eccentrically. Alright, lastly we have return to play. Um, according to the ACSM, an athlete can return to play if all of these conditions are met, which includes anatomical and functional healing is stable, acute injury has been resolved, little to no signs of chronic injury, athlete poses no threat to others, sport-specific skills are restored, the athlete is psychologically ready, the athlete can perform safely with equipment modifications, bracing, and orthotics, and lastly, compliance with federal, state, local, school, and any other governing body regulations. Another useful tool when it comes to evaluating an athlete for return to play is patient self-reporting. Um, Patient self-reporting has had pretty good results when it comes to evaluating the progression of rehab and how well an ankle injury is healing. There are many instruments that have been developed to rate these patient self-reportings. A few examples are Activities of Daily Living Subscale and the Sports Ankle Rating System. The next thing we can look at is performance tests. When performance testing, the injured ankle should be about 80% strength of the uninjured ankle before return to play can occur. Performance tests can be measured through time, distance, speed, and there are many different uh, types of performance testing, and it's often good to do performance tests with the uninjured ankle first and then follow that with the injured ankle to see if you can match the scores, to see how close you are to matching the scores, and assess how well the ankle is healing. Um, Following this is a few slides showing some of these performance tests. And one of the last things to look at before return to play is activity-specific or sport-specific training. This includes things like running, cutting, plyometrics, more sport-specific exercises. Um, at this point in rehab, orthotics are advised. It, orthotics can help increase foot proprioception and help stabilize the foot and ankle. Also, ankle braces are advised at this stage and when returning to play because it can help reduce the chance of re-injury greatly. And lastly, right before we wrap up this video, it's always good to check for ankle instability in your athletes, and the tests we can use for this are your anterior drawer, posterior drawer, Taylor tilt, and Kleiger's tests. Alright, well thank you everyone for watching, and I hope y'all have a good day and a great midterm week.